The Dental Brief is brought to you by Omni Premier Marketing and the amazing guests who bring wisdom and advice that you can put to use to take your business and practices to the next level. Find us on Facebook and join the conversation. Get ready to grow because we are kicking off the next episode in 3, 2, 1.
Hello, everyone. Welcome to another episode of The Dental Brief. I'm so excited for today's guest. Mandy Madeline, say hello to everyone.
Hi, thanks for having me, Patrick.
Great to have you here. It's going to be a fun episode, as they always are. I'm going to go ahead and put your website out there right now. It's payproudlyhealth.com. Of course, that'll be on our social media and on our website as well. Mandy, tell us how you started working with dentists. How'd you get involved in this fun industry?
Sure. I'm Mandy. Thanks again for having me and tell you a little bit about how I got involved in dentistry. So I started back in 2008 and I was attending college and remember hearing a commercial on the radio about a dental assisting school. And that moment really changed everything for me. I signed up, went through that program and really fell in love with the profession. From there, I spent many years as a dental assistant and then eventually moved into leadership and operational roles within the practice. So I really grew up in the dental field and really gave me a full view of both the clinical side and operational side in running a dental practice.
That's awesome. How'd you get to where you're at now? Right. So how'd you get from there to here today?
Yeah. So back in 2021, I was looking for a new payment system for our dental practice for a couple different reasons. Two main reasons. I wanted to do something really fun and develop an in-house membership program in our office and get rid of the third party because of the astronomical fees that we were paying. And so I needed to find a credit card processing company where we could set up recurring payments. And so in doing so, that's when I found Pay Proudly, and which gave us the ability to set up those recurring payments. And then also we did not know, but we were way overpaying in processing fees. So that was an eye-opening moment for us. So we were able to do that in-house membership program and also save thousands of dollars a month on processing fees. And I really just became passionate about wanting to bring this solution to dental offices across the country. So I personally was able to implement it in my last practice. And now I'm able to bring this solution to practices across the country and save them money, give them better solutions, and take control of their membership programs. And they know now what they're paying on processing fees.
Yeah.
And we're bringing clarity to the space.
Yeah, it's a lot. And obviously that's, the conversation today is certainly about cost, right? Some people think we're in a recession or heading towards one. People are getting a little bit nervous. Obviously, we have staffing issues still across the country in dental practices and people wanting higher wages, which cuts into profits or can cut into profits. What's the average practice paying in dental and credit card processing fees right now? What are you seeing?
Yeah, so we're seeing practices paying anywhere from 3 to even 6% in processing fees.
Yeah.
When you look at these offices that are using outside membership programs, third parties for their membership programs, we're seeing them pay 10 to 13% on processing fees for those membership transactions.
Yeah.
It's really something for offices to take a look at.
Wow.
And, something that we provide to our office is the free analysis. Let's take a look at what you're paying today and let's break down your statement, see what those processing fees are. What are the monthly fees? Are you PCI compliant? And just take a look and see where you're at today and what we can do to help you.
Yeah. And I see on the website, again, it's payproudlyhealth.com. Schedule a demo. It's right there on the site. Going back to that percentage, 3 to 6%. If you're a fee for service practice doing $100,000 a month, I mean, we're talking $30,000, $60,000, $50,000, $60,000 a year that you're spending in credit card processing fees. I mean, that's money that could be used to market your practice. It's money that could be used to bring on an additional team member to answer the phones or assist, or it could just be bonuses for the practice owner and maybe some team members. That's a lot of money. I mean, that's a lot of money.
Yeah, it's a lot of money that we want to give back to you for you to invest into some of these other things to grow your
Yeah.
practice. And another thing that we also offer, we have the traditional route where we can bring that percentage down, of course, and continue in the traditional side. Or we can move to surcharging. And we have lots of offices that are doing that today, where if a patient chooses to pay with a credit card, there's a 3% that's passed on to the patient. So they're absorbing that cost instead of the practice. So we have lots of offices that are successful in implementing that surcharge option today as well.
What does that look like? And let me say too, and there's always rumors and untruths, especially on the internet, as we know. But I see sometimes on some popular Facebook groups, dentistry, people are like, oh, I'm going to start charging my patients to accept credit cards. And then some people come in and say, hey, that's illegal, or you can't do that. It's against the terms and conditions of your credit card companies that you're signed up with. I obviously don't know, right? So can you kind of clarify that a little bit? What can dentists do? What is illegal, if anything? What does this whole mess look like?
Yeah, so what they can do is charge a 3% on credit cards only. So in a surcharge environment, it can only be 3% on a credit card. So if people are doing that on debit cards or HSA cards, then you would not be in compliance. That's not legal to do. So you want to make sure that when you're passing that 3% on, that it's on credit cards only. Our system is able to detect the difference between a credit card and a debit card. So we would inform you when a patient goes to insert their card, when it's debit, when it's credit, and do those calculations on our end to simplify things for you.
Yeah.
So that's one thing. And the other thing would be making sure that there's signage in the office. You want to communicate it to your patients. You want them to be aware. So we provide verbiage to our offices and signage to our offices so that they have that posted and that patients are informed.
Sure. Makes sense. How do you kind of smooth this over with patients? Like what's the best way to do this? Because I'll say that if I went to an office and I threw down the card and they're like, it's a 3% fee, I would stop paying with a card for starters at that particular business, or I might be kind of turned off to that business. So what's a good way to kind of smooth that out with your patients so that they're not getting upset that they're getting charged this additional fee?
Yeah, I think the best thing is giving them options, right? Letting them know that, if you want to pay with debit or HSA, we can go that route, or we can talk about setting up a recurring plan. You can utilize our membership plan. Giving them different payment options is going to be the best way to make it something that patient understands and can get behind, because you're not giving them just one option. You can only pay with credit card and there's going to be a fee and that's it. You want to give them options. So that's the best way, I would say.
Yeah, that makes sense. So if someone wants to learn, first of all, if they want to kind of get a comparison on here's what we're paying now, what can you do for us? Is that something that you can do?
Yeah, so that's something you can do, and we can do two different things on the website. Like you said, there's a place to schedule a demo, and then I just ask to review your last 30-day statement. So I have you send that over to me,
Yep.
and then we can plug that into our AI tool and present you with all the different fees you're paying today, and then what it would look like if you were working with us and how much money we can save you each month.
Yeah. What's your kind of response when dentists get that back? If you see them face to face, when they look at it, what's the look on their face like?
It's eye-opening for them,
Yeah.
for sure. And, a lot of times I hear they say they're embarrassed.
Yeah.
They're embarrassed. They hate that they've been paying these high fees for who knows how long, months, years. A lot of these companies they've been working with for years and really have had no idea how much they've been paying.
Yeah.
And so it's eye-opening, it's shocking. I've had dentists that have said, like, I'm embarrassed. But, we want to bring clarity. We want to provide you with a solution. We want it to make it better. And that's why we're here and that's what we're doing. And they're not alone. They're not the only ones that are in this situation.
Sure. Yeah, that makes sense. Check out the website, everyone, payproudlyhealth.com. Mandy, thank you so much for coming on today and sharing with us and helping dentists improve their lives and improve their practices. We appreciate you.
Yeah, thank you. And, at the end of the day, dentists should be spending their time focused on patient care, not worrying whether they're overpaying on credit card fees or systems that just don't serve them.
Right.
And again, that's why we exist. We want to take that off their plate. We want to give them solutions that work for their practice.
Yeah, that's awesome. Thanks so much, Mandy.
Thanks, Patrick.